When differentiating lumbar nerve root pain versus piriformis irritation for the sciatic nerve, first rule is to rule out spine complaints with various testing. And then to trigger it with testing the piriformis, here's a couple tests that I might use. One is a modification on a straight leg raise, where we're just going to bring it up to where it's non-painful here, but if we start to rotate it inward, that might bias the piriformis muscle more and cause reproduction of symptoms. Okay? Or we can slack the nerve and simply stretch the piriformis here, or add some overpressure. That's going to trigger piriformis pain much more reliably. And also with palpation, if I just step the foot over here, follow along the thigh to the trochanter, and flick across the tendon of the piriformis right here, that would trigger piriformis pain as well. So now when we want to treat it, we've got her stacked in this 5-month side-lying position, and I'll make note of this daylight that we create right here, okay? So she's supporting on the hip and the shoulder joint, and what we're going to do is the piriformis muscle basically runs from the sacrum down to the trochanter right here where she's bearing weight. So it runs right along my hand right here, and as she rolls forward, she's going to basically try to take this knee and bring it towards the wall, but no motion, good. And as we do that, it's lengthening this right here. It's lengthening it as she's bearing load into it. So we're going to just roll this way, back, hold here, hold this position, good. You can resist my pressure here, fight me, good, breathe. Good, now roll forward as far as you can through the hip. Good, and come back. And as we're here, we're going to then really create that tension in the hip and then breathe down into it. Because piriformis, it's a pelvic floor muscle too. So hold here and create that breath right into my finger here. Good, perfect. Again. So you can see the expansion right here as she breathes in. That's perfect. Good, come back. Now let's move this up a notch. So we've verticalized the posture a little bit and gone into a 7-month position where we can do the same motion. Now without lifting the hip off the ground, she can just turn the hip over the down knee to generate that tension in the posterior hip right there, in the piriformis and the deep hip external rotators. And then she can come off the hip and onto the knee, okay? And we have this loaded position up. So now she's really bearing weight here, and she can, again, she's going to breathe down into it. As she inhales, you can see the expansion laterally in the lower ribs right here. Perfect. And that's using it in like the support roll and in the pelvic floor roll right here. As she comes back down, if we can rotate down and really close over her left hip here, good, to lengthen this under load eccentrically. Make sure that we're stacked from elbow to opposite shoulder. She should be pretty strong against my pressure here. If I really press into her, she stays stout. If she's slumped in the shoulder here, so good. So now her tolerance to compression against me is dirt. Okay, we want to have this nice and stacked like that. Shoulders a long ways away from the ear. And here you can get a viewpoint on just that subtle turn right here. And if she gets that closure over the hip socket right there, that's our tension in the posterior hip and piriformis muscle. So that was a good breath you could see right there. And here she can come over off the hip towards the knee. And if you're particularly tight, this is a great way to stretch it, because as she comes down right here, she's going to close, close, close. I like to envision, come back up again, that the thigh bone's a piece of taffy, and it's pinned here, and as she sits back down, she's trying to sit the back end of that taffy further away from my hand to get that deep stretch in the posterior hip right there. Good. And here we've just verticalized the posture more. She's still doing the same thing, supporting on the same side, arm and leg, creating rotation over that hip and leg. And here we're just more vertical. Here we can come off the hip and onto the knee. Support here, breathe down into it, feel the expansion in the lower ribs. And as she sits back down, we can create more closure here and sit back. Good. She's going to come over and off the hip and onto the knee. And in this posture, it's nice to be able to work on opening and closing over the hip. So she can close down a little bit more and open a little bit more. This coordinated movement, creating rotation at the hip, but not rotation at the spine, is vital in life, and especially in sports like golf or tennis or pickleball, sports where you're creating rotational power. And you want to use them big hip muscles, not the rinky spine muscles. Good. So if I want to do some manual on it, some ART on it, it's this motion here. I'm going to bring the knee up, bring the foot down, and then I'm going to bring the knee down as well, trying to keep the pelvis relatively in place. And my fingers here are providing the therapy. okay? Now, when I'm close to the outside of it, on the lateral side of it, it's pretty superficial and I can actually do work there. Whenever it comes to like getting very deep into the hip and I get into the belly of the muscle, it's like 10 centimeters down easily. So I've got to have quite a bit of pressure here, or better yet, I might switch to a dry needling technique, or just treat it with exercise. If we want to manipulate this,